Hey, my name's Gabby Bramblett and I'm presenting my patient. I am presenting my case for a 41-year-old Hispanic male and his chief complaint is cough. The history of the present illness, the patient states he's had a cough for a week. It's been worse at night with some yellow sputum. He also complains of a runny nose and nasal congestion, sore throat, and myalgias, although he denies any kind of fevers. He tried over-the-counter NyQuil and he's had some relief with that. His review of symptoms, general, he does not complain of chills, fatigue, fever, or persistent infection. He does complain of nasal congestion, rhinitis, sinus pain, sneezing, and sore throat. He does not complain of a decreased sense of smell, ear discharge, ear infection, ear pain, or earache. He does not have any facial numbness or tingling, any headaches, or any ringing in his ears. He does complain of a cough with yellow sputum production and no complaints of difficulty breathing, no complaints of breathing on exertion, no chest pain, and no swelling. He has no past medical history. He does not smoke. He drinks alcohol occasionally and no street drugs. He does not take any allergies and he doesn't take any over-the-counter or prescription medications. His vital signs here, his temperature is 98.0, his blood pressure is 135/77, heart rate of 59, and respiratory rate is 16. He's alert, cooperative, oriented ×3, well hydrated, normal cephalic, atraumatic head with no lesions or palpable masses. His facial muscle has normal strength and tone. He has full range of motion, no carotid bruits bilaterally. His neck is non-tender. I don't notice any lymphadenopathy, no palpable mass bilaterally, and his trachea is midline. He has no palpable nodules on exam of his cervical lymph nodes and no tenderness to palpation. His respiratory effort is quiet, even, and easy with the no use of accessory muscles. On auscultation of his lungs, he has normal breath sounds heard with no rales or bronchi. He has normal heart sounds, rate and rhythm are regular with no murmurs, no digital clubbing, no cyanosis, and no edema noted. Upon an exam of his ears, nose, mouth, and throat, he has normal pinning with no scars, masses, or lesions. His otoscopic exam reveals normal external auditory canals. His TMs are clear and mobile. His nose, there are no scars, lesions, or bony deformities. There's no tenderness on palpation of his maxillary, frontal, or ethmoid or sphenoid sinuses. No cough is noted during the lung exam, and his nasopharynx is normal and without visible mass. His exam of his oral cavity reveals normal lips, teeth, gums, and oral mucosa, and hard and soft palates, tongue, tonsils, and posterior pharynx are moist and symmetric without lesions. His carotid arteries also are normal and no bruits noted. My differential diagnosis for him are: number 1 would be an upper respiratory infection, number 2 would be pulmonary embolism, number 3 would be congestive heart failure, number 4 would be a bronchitis, or number 5 would be a community-acquired pneumonia. Given his negative findings on his exam and his lack of shortness of breath, he has none of the risk factors for pulmonary embolism, and he's got no edema, no rales, no crackles. I'm going to rule out the pulmonary embolism and the congestive heart failure. I would treat him with an upper respiratory infection. I would begin Tessalon pearls, 200 milligrams by mouth 3 times a day as needed to help with his cough, and he would also begin Mucinex DM, and he would need to take 2 tablets every 12 hours for 4 doses, and then 1 tablet every 12 hours. I would also recommend ibuprofen. He could take 600 milligrams PO 3 times a day as needed for body aches and myalgias. And then I would talk to him about throat lozenges, gargling with warm salt water, rest and increasing of fluids, give him a work excuse as needed, and have him, if he got worse after 4 to 5 days or started running a fever or having any increasing respiratory distress or any other problems, he would need to come back to the office. Thank you.